With the patient experience and all of us working together, are there any gaps that you see from an industry perspective that, we all might consider? Obviously the patient perspective, the advocate perspective, and then with industry and also our healthcare, professionals working together. Are there gaps that you see that we could be addressing better? And that could be education or supportive systems, anything along those lines? Tim, I guess I'll go to you first.
I think that the gap isn't in the available information. I think that the gap, if there's a gap, is getting that information to the patient. And it kind of comes back to, I think, maybe a point I shared earlier, but just about, how distracted and how busy providers are in their practices. I mean, they're taking on a ton of stuff with healthcare reform and changing, payment systems for care and, how care is being delivered and consolidation. I mean, there's just a multitude of things that are just impacting and stealing providers' time away from, having that quality engagement with their patients. From my perspective, I think it's trying to make sure that the system gets that information to the patient. So maybe an example is that a patient comes in, they have their consult, they have their education with whoever the nurse educator is as part of the practice or the clinic, but as a part of the information that is shared and given to them when they leave that clinic is references of advocacy groups, references of other resources, encouragement to make a call or maybe even a warm transfer from that clinic to one of these groups. So they can avail themselves of all the great services that you provide, whether it's additional patient information, whether it's a connection with a buddy, a peer buddy, to help them, with their journey, to anticipate what they may experience, and try to kind of stay ahead of some of the things that they could anticipate in terms of maybe potential, side effects or other types of whatever it may be, is to make sure that they kind of create that envelope around themselves, to help them. So, I mean, I think that that's probably one of the biggest gaps that I see and I hear about the most.
Yep, I would agree, absolutely.
I think that's a really good point. I think a lot of times cancer patients can feel isolated and feel like they don't have access to all of the resources. And I'm not sure how many of them are aware of how much support that they can get from the advocacy groups.
Right.
Whether it be education, support for understanding clinical trials, answering questions about what to do about side effects or what their options are, even like just random common sense tips for how to manage through things while you're dealing with cancer. There's a lot of support, but the other part of it too, coming back to industry, is the advocacy groups help us really to understand what the unmet needs are for the patient, how they want to be supported, how they want to receive education. So helping us hear that patient voice so that we can actually be the support that they need. I think industry really wants to support patients.
Absolutely.
And we can't do it without hearing from them, themselves. So
Right.
Working with advocacy groups, we can kind of hear their voice, and that works if they partner with you as well and tell you what are our needs, what do we need, and share that journey. So in addition to getting, the help and the tools that exist today, they can also help improve the education and what happens in the future, helping us to identify gaps by telling the advocacy groups themselves.
And I think too what both of you said is so important, and that's one of the reasons we had wanted to start the GI Cancers Alliance, because within the Alliance, we have some very small disease states that maybe don't have the advocacy, the huge advocacy groups as some of the larger disease states. So it's so important to us that those needs are met, across all of the GI cancer spectrum, in exactly what both of you just mentioned. I think that, another thing that we're so concerned about is for rural areas, inner city, underserved communities, that we're able to give them that same access and information that is maybe out there in the larger centers and things like that. So Well, I appreciate both of you being here today, and it's been a great conversation, and again for your partnership and collaboration with our GI Cancers Alliance. And for everybody listening today, it's been a wonderful conversation here with Tim and Heather, and thank you for listening to our Cure Connections broadcast. For more information, you can visit our website at gicancersalliance.org. Thank you so much.